I'm Kim Novak, and I'm excited to have this opportunity to join with you today, this afternoon. We appreciate your choosing this particular session. A couple of little things I'd like to let you know is that this program is intentionally designed to not tell you what a bystander education program should look like in a nutshell, but really to get us to think critically about how do we access that as an educational initiative. Maybe for some, why should we access it as an educational initiative? And then how to be a little more intentional in bringing it into our college campuses. So that's really the format for it. And I share that because, we all come into these rooms with very different expectations. And I think the little learning outcomes or the 3 bullets on the program description may not always capture what we're trying to convey. So I want you to know that if you just decided based on that, oh, I'm in the wrong room and you need to jet, we won't take offense. Would you agree, Leslie?
Sounds good.
We're truthfully dedicating time to questions towards the end. We have solid graduate student timekeepers, and they have let us know that they will tackle us should we not stop. And they're not going to wait to tackle us till we've already given up the Q&A time. They're going to tackle us before. Is that accurate? Or was it throwing something? I couldn't remember which it was. A shoe will be flying across the room. So you, right there at about 10 minutes before the end of the program, should duck. But if you're that person, I am sometimes this person, who has a burning question and you really can't move forward with the curriculum without asking that question, then raise your hand. Because we don't want you to feel frustrated and hold a question till the end if you really need to share it sooner. If we feel that we'll get to the answer, we'll let you know, but we won't parking lot things. We're not, do you ever have the proverbial parking lot in staff development? And it's like we park stuff and then we never talk about it again. We're not going to park it. We'll get to the question. My experience with this particular topic comes from 2 backgrounds. I'm an independent consultant. I have 16 years experience on college campuses, working in pretty high-risk areas. I was a student conduct administrator, and then I worked with threat assessment teams and crisis response. Probably the defining aspect of my career was building the first student affairs risk management program that was comprehensive to student affairs, and I had the chance to do that at Texas A&M University in 2000 following their bonfire incident that occurred. And it was through all of that I found my way into this wonderful world of what we call prevention science. And then dealing with high-risk behaviors was introduced by Dr. Alan Berkowitz and others to this principle of the bystander effect and what bystanders are. And it just makes good sense to me to merge that prevention stuff and the risk management stuff and the bystander education all together. And so when you do that, you go out and you find someone who's actually lived in that world. And I found my colleague, Leslie Fasone, from Indiana University, and Leslie brings the talent of being actually you're the new program coordinator for the Bystander Intervention Initiative, right?
Mm-hmm. Yes, correct.
And what else are you doing these days?
So I am also a doctoral student in health behaviors, which is our School of Public Health. I've had 6 years of experience working in student life, our Division of Student Affairs, specifically with fraternity and sorority students. So I've worked with high-risk behavior populations for 9 years, actually, professionally, but 6 at Indiana. So that is my background, and about a year and a half ago, we started an initiative where we obtained some funding, a little bit of funding, to develop a program. So I've been leading a team of individuals along the way. So we're going to talk about bystander intervention and talk about program development and use Indiana University as some examples, but hopefully you can have some takeaways throughout the presentation of how you can apply this to your university, to your campus community. So
right, and as far as supplemental handouts, because we have a very brief document that we provided that will go over the steps, but also loaded up earlier, prior to the conference on the website, is a supplemental project that was actually done by the Higher Ed Center in Washington, D.C. A group of our colleagues researched model, and they use the term model. That means a lot of different things to a lot of people, but they looked at variant types of bystander education initiatives and compiled a really nice report of some of the best practices and the implementation strategies. And so rather than to just reinvent the wheel, they gave us permission, so we've uploaded that for you. And then based on an idiosyncrasy of one of the 2 of us, I won't tell you which one, our PowerPoint goes up after the presentation. But it will be on the Vermont website and not in a PDF form, but it will go up, so you'll know. Because I know that the handouts are important. I can tell by the piles of them all around the conference center that somehow we needed to have those. Our outcomes are pretty straightforward. Primarily, I think it's just really important to know that we're not going to teach you the Indiana University model. Leslie said, Kim, I'm not a fan of that. We are going to use some of Leslie's work because it's quality work as a backdrop. But really, our hope is that you'll have some insight into how to bring this type of an initiative to campus. Let me really quickly poll the audience. Have any of you been given the directive or had the idea to develop a bystander intervention program on your campus? How many have come up with that idea independent of a directive? And has anybody been told, hey, we're going to do a bystander intervention program, so could you make that happen? Yeah, we have some people in the room like that as well. So this will really speak, hopefully, to both groups of people, because traditionally, I think what we do is somebody says, hey, this bystander stuff looks good, let's do it. Well, what should it look like? Well, this is what it looked like at Central Missouri, so let's make it look like that on our campus. But how variant and how different is Jennifer's campus at Elgin College from Central Missouri? Very different demographics of individuals. What the work that Jenny Rabas did at Central Missouri is mind-blowingly good prevention work with bystander intervention and alcohol, particularly with her fraternity and sorority community, but I don't know that it fits everywhere. Or sometimes someone will say to us, hey, bystander program, go create one. And we don't know why, and we're not sure where to place it or what it should look like, but at the end of the day, we know we have to get it done because somebody has told us to. We're just going to step back for an hour and 15 minutes and figure out how to do that a little bit more effectively. Because the most powerful thing that we have learned in our work, and Leslie and I think are both really committed to this issue and this initiative, is that therein does lie the answer. There's not a lot of research on the evidence-based outcomes of the impact of a solid bystander intervention program. Some institutions, and you'll see that in that report published online, have put some good data together about their effectiveness or the response to their initiative. But there's something intuitive about this initiative that tells us that if we know that most socially unjust or public health or high-risk concerns or behaviors that occur on our campuses are oftentimes witnessed by someone who had some opportunity to intervene. And ironically, that someone often has a shared value. Maybe they're a member of a student club or organization that shares values of that student club or organization. What if it's a faculty member or a staff member who we would hope is sharing the values of your campus community? So it's not just the person who doesn't act, but it's someone who has a shared value. If we know that those individuals are present at these times, then why would we not capitalize on them as a mechanism to help bring about change? And so I think that's really a key thing to know, is that there's a value in understanding all of this.
Perfect. So as we dive in to talk about bystander intervention, we need to understand some key definitions and terms. So we have the definitions listed for you. So basically, the bystander effect is that the understanding that the more people that are present in a situation, the less likely people are to actually intervene. So understanding and helping students and staff understand that in an environment where there are more people present, the likelihood to intervene actually decreases. A bystander is somebody who is there for a problematic situation but does not intervene for whatever reason. The bystander intervention program, as we talk about that, it's more conceptually large program focused on changing an environment or culture, whereas bystander intervention training is going to be more of a specific training program focused on targeting specific behaviors and skills to try and teach individuals to intervene.
And all of these terms really come into play, but oftentimes we don't see them when we're talking about a bystander program. Traditionally, the only definition that usually comes into the room is the definition of a bystander. Some terms that you may hear instead of a bystander intervention program is maybe a prosocial behavior initiative. Leslie and I toyed around up until about lunch today about which one, and we just aren't hip enough to say prosocial movement because it felt, I don't know. Yeah. I don't know, but it's definitely another exchangeable term.
Definitely.
I think that we see.
Yeah, and I think that the concept is we want people, not just students, we want people to just be helpers in the community. We want people to do actions that are prosocial where they just help one another. And so really conceptualizing how do we create an environment where people care about one another and act. And so bystander intervention, we tend to think of a spectrum of problematic behaviors, but sometimes it does just mean encouraging an environment where people can just help one another in many different ways. So let's talk about a little bit about the history of the movement. In 1964, Kenny Genovese is a woman who was sexually assaulted through a sexual violent situation. Her perpetrator actually had left the scene 2 different times and returned a 3rd time to actually kill her. And so the New York City Police Department, when they were investigating this, found out that There were several people around the incident, but nobody intervened. And so the times that the perpetrator had left, lights had gone on, he thought that somebody was coming, and then actually returned to kill her. So what they discovered from that was the bystander effect and the social phenomenon. So some researchers, especially in social psychology field, started studying this and tried to understand, why don't people intervene in problematic situations? What is going on, and try to understand the psychology within the social constructs of why people don't intervene. So between 1968 and 1981, there was a number of studies done, and then about in 1994, Alan Berkowitz started trying to understand the bystander effect, bystander intervention, and applying it to college students. And recently, within the last about 4 or 5 years, it's kind of becoming a trend, a good trend, in terms of student affairs, to try to really understand how do we apply this to college students? How do we teach our students and in our environments how to intervene, how to talk to the friend that might seem like they're really depressed or potentially suicidal, anything from that to somebody's too drunk, do they need to go to the hospital if they have alcohol poisoning? So trying to understand that is where we are now. And in 2010, the Higher Ed Center saw this as a bystander intervention as a prevention mechanism for adapting to college students, and identified it as a priority.
Well, and what's really interesting in the history of the movement, what I really like about this from the concept, particularly in working with students, but not just students, campus environments, is this is not one of those phenomenon that we're pointing at students in particular and saying, this is where you're bad. We do that a lot. We talk about the propensity for high-risk behaviors. I tell fraternity men all the time, you belong to the highest risk population on any college campus. Boom. The data says it. It's not just conjecture, it's not a rumor, it's not myth. But what's interesting, and sometimes that's hard to take, but bystander, the history of this movement shows us this is not something that college students created, nor is it a social phenomenon specific to our students. So the potential for a bystander intervention initiative, or even simply bystander training, to capitalize on that beyond your students, to faculty, to staff, administrators, and others in the broader community is massive. It has so much potential because it's a phenomenon that happens in society. And for those of you who maybe haven't had as much exposure to it, you know when we learn about it, that's what's interesting. As the history of the movement shifted, it was really, don't you think, Leslie, like the Kitty, the situation with that poor young woman in New York, brutally raped and murdered. And how intriguing is it to know that a number of people, and the number varies in the different reports from 12 to 38, heard the noise, had all opportunity. The first call to the police was after people knew she had died. And that just befuddled the New York City police. I mean, at that time, they didn't go, oh, the bystanders. They were like, wait a minute, what has happened here? And it's interesting because for a long time in our history, those were the only incidents of bystander education we talked about. We only talked about the most extreme. There's videos we've seen of like the woman waiting in the emergency room at a hospital, and there's a news channel that shows the video, and she's waiting in the corner, and she looks to be a little disheveled and maybe not properly dressed when you see what other people are wearing when they walk in. And as she sits in the corner, and the clock, you can see a clock going hours and hours and hours by. About 8 hours, I think it is, into her sitting there, she drops to the floor, and people literally walk around her body. And there's a realization several hours later, the clock is still ticking. You see it, the video, and there's a realization that she's not passed out. She's actually been deceased for a number of those hours. And those are very extreme situations. When we hear about people being actors and not bystanders, we hear about the people, I think it was Utah, that lifted the burning car off the motorcycle and saved the person. All very positive. That's a very positive, heroic thing. But it doesn't have to look like that. And I think that's where people like Alan Berkowitz and Leslie Fasone and the Step It Up program have taken us historically, is to know this doesn't have to be uber heroic, that this is an opportunity to simply say something, do something, not engage. So the complexity of the concept isn't difficult, and history has shown us that it's really, I think, the complexity of the design. So when we talk about this in the concept of a prevention approach, not to make that too complex, what that means is before you just simply adopt a bystander intervention initiative or create a bystander educational outreach program, that you think critically about it, and that you start with the public health model and you say, well, what's the problem we're trying to address look like? And we could start very broadly with that, bystander behavior. Well, what does that look like? And when we talk about that, understanding the problem, it's really stopping and saying, first, why do we believe we have bystanders in our community? What evidence exists that that's the case? Now, we know the researchers say most socially unjust, high-risk activities, public health concerns on campuses are witnessed by another party that could have stepped in. But what does that look like on your campus? Have you had incidents? Is your conduct office seen reports where, I remember when I was a student conduct officer, hearing about the sophomores. I worked on a campus where the residential environment was very fraternal, social fraternity in its structure. Definitely not, they were not advocates of the fraternal movement, but ironically, they functioned like them. A lot of very small groups of upperclassmen would stay in the residence halls and then lead the community. People moved into residence halls as legacies because that's where their dad lived or their mom lived. Really like an interesting cultural phenomenon. And I can remember meeting with a young man who decided one day in Walton Hall to take wire snit cutters in his teeth and go into a vent with the intent of cutting the cable, this is how old I am because they even run coax cable for cable TV anymore, probably not, to cut the cable and cut everybody's cable access off in the residence hall. It really probably didn't matter to him at the time that there were other wires running simultaneous to the cable wire, and I don't know that he knew which one he was cutting. We were fortunate that he only cut cable coax and not some power line. And when he came in for his conduct meeting, and we talked about, one of my favorite things to ask students was always, what made you think this was okay? And he said, well, there was some of the older guys, the sophomores, were hanging out, and we were just eating pizza, and they were like, it's always, every year we do a prank on the whole hall, and they told sensational stories about what their pranks were, and you guys really need to come up with your prank. And they helped with a little social lubricant, alcohol. They helped generate the prank, and then they waited for the young man to actually make it into the crawl space. They helped him access it and all that. And so when I charged them, and they came into my office, they were so offended. They said, we didn't commit the act, we were just there. So I started to see, even at that time, oh, wait a minute, there's a bystander effect. There's bystander behavior. How do you know what it looks like? Where's it occurring? Is it something that occurs predominantly around certain types of behavior? Are you working with faculty and staff are your faculty bystanders to academic dishonesty? Do they engage when they see it and they know it? Or do they not engage? Do they not act? Because that's a shared value, right? Integrity. Do your students, are they really comfortable dealing with racist or homophobic incidents on your campus? But when it comes to high-risk drug use or alcohol, they're really going to back off because they don't want to really get anybody in trouble. So it's really taking the time to say, what does this look like? And then trying to discern in your own community, what contributes to this? Why does it happen? And we're going to share with you what the research tells us about why it happens, but keep in mind that knowing that is important to the development of a good initiative. It's critically important. If we understand why something occurs, then we know what needs to change. And if we know what needs to change, we have a better chance of actually changing something. That's the whole concept, oversimplifying. Because that's, in this model, that's when we would then create this measure of the bystander program to intervene. Make sense? Tracking? And then evaluate. To my student affairs colleagues in the room, have we gotten better at that? I think we've gotten better at it, but man, I know in my history, taken lots of dings from my faculty colleagues because they're like, how do you know? How do you know that's effective? Well, 740 students showed up. Oh, okay. You put bodies in the room, but how do you know you made a difference? And so Leslie will talk us through some of that. But really, this is the framework for what we want to challenge you to think about, because it's truthfully, I got this right? It's not enough to use science to define the problem. We can't just get so bogged down in the scientific approach that we forget. Somebody in this room was told, develop a bystander program. Somebody else has already started down that road, so they just want to move forward. But we also can't just lay programs over the top of our campuses. And this thing's gotten hot. I mean, there is a lot of movement out there on bystander behavior. Anybody watch that? What's that TV show that's on?
What Would You Do?
What Would You Do? Anybody watch? Anybody going to openly, publicly admit they watch What Would You Do? Yeah, you're watching it, aren't you? Did you ever yell at the TV? Never? Never. Only in sporting events. Truthfully, are you going to be shocked by this? I'm a TV yeller. I yell, if there was ever a camera put on my television set, my sons would be more embarrassed than they already are of some of my public behavior. I'm home alone yelling at the TV.
Especially during
but
football games.
A lot of people watch that. I mean, that's like a sensationalist thing. The media is reporting on it. Groups all over the country are creating hero awards. There's a national initiative called the Responsibility Project, where you take a pledge to be an everyday hero, and it's blowing up all over the country. 100+ college students gathered in the city of Chicago this summer, and their classroom was the streets of the city. And they went out with some training from specialists in this area and observed the bystander effect in the play, and then practiced their skills of not being bystanders out in the streets of Chicago. Just for the risk managers in the room, because I was freaked out by this, they had actors staged when they did their skill practice, but the students didn't initially know that. This is hot stuff. So someone, if you're not thinking about it, there's probably somebody on your campus who's like, the solution is the bystander program. And it's good to be there, but you have to really be more intentional in your design, I think, of the initiative.
Right, so it's important for us to really understand why don't people intervene, and I think one of the benefits of working at an academic institution is that we have a lot of faculty, we have a lot of knowledge, yet sometimes we don't take the knowledge and the research and actually apply it. So it's important for us to try and bridge the gap. So as we talk about the bystander intervention program, there are several factors that are a part of the psychology and the understanding of why don't people intervene in situations. So the first one is social influence, and this just is the misjudgment about what other people think and the understanding of the social environment and the influence that it has on individuals' behavior. People do not behave in a vacuum. So understanding that the environment and the groups that they're a part of, their family environments, all have an influence on their behavior. Pluralistic ignorance is the assumption that nobody else cares about a situation. I'm concerned about it maybe, yet I don't think that the other people are in this situation are concerned about it. Research tells us that if somebody actually turns to somebody else and says, hey, do you think we should do something about a specific situation, they're more likely to intervene. So just encouraging people and students specifically to talk about it when they're concerned, then they are going to be more likely to actually do something in a situation. Fear of embarrassment is a concern. So somebody is in a situation and they try and intervene, they might be afraid that they're drawing attention to themselves, especially when we think about the bystander effect and maybe how many people are in a situation. If they're the only one stepping out, they're like, why am I the only one thinking this is wrong? Okay, now I'm going to go step out, and then I'm the only one doing this when maybe there's 100 other people around. So they might be afraid that it's embarrassing. I'm sure that you might be able to think back to your own situation, maybe a time that you could have stepped up but didn't because of your perception or fear of embarrassment. Also, the diffusion of responsibility, I think, is a key factor. Sometimes when I talk to students about whether or not they think that they've intervened or they should have intervened, and they'll share with me stories, they sometimes will talk about this assumption that, well, that person, that girl was with her friends, and so I didn't know if I should do anything. So they didn't step up and assume responsibility. So it's this assumption that it's somebody else's problem and not mine. And so encouraging them to take responsibility for situations is a key role, is a key factor that we can do to try to encourage intervening. Fear of retaliation as well. For stepping up and actually saying something, I know that this is key, especially for victims of situations of if they want to report and try to get help that way. Sometimes they're afraid of being retaliated against. This might also mean if a student's walking in a situation, into a situation where there's maybe some discrimination going on, and they might be afraid that they're getting retaliated against as well. So understanding that component is important. And the last one is very, very, very important, and this is what I discovered after talking to students, is that they lack the skills to act. So they really need the skill set. Sometimes I think that they have the skills, but more so it's about the confidence. And it's the self-efficacy and belief that they can actually do something, and then that what they can do can actually create change. So it's really important for us to provide them with the skills and consider how can we do that within our programs that we're creating.
Yeah, and I think, you know, the staff faculty side, how many of you are here in a faculty role, or you're predominantly connected to faculty? I know my colleague from the University of Seattle, and there's others. But think about this in the context. One of the things that Dr. Berkowitz will do, and I don't know if any of you have had the chance to hear Alan speak. He was at Cornell for a long time, definitely the old hippie from New York, cool guy, just fun. Don't ever put Alan in front of 900 fraternity men. I watched that happen, and he was amazingly cool and awesome, but that's not he was like, well, that's not my thing. I won't be doing that anymore. But amazing guy. What he'll do sometimes is say, think about a time when you might have been a bystander or when you saw something and didn't act. And when I think about that in the context of our experience here, I think that, again, it's remembering that while Leslie brings this student experience, there's a concept in the community to think about. Some people may be here thinking about, what are we going to do about faculty bullying? I'm going to do a conversation tomorrow about bullying, and I know people are going to ask me about faculty bullying. Well, maybe one of the contributing factors is people are bystanders to it. Or what do I do about faculty that aren't reporting incidents of academic integrity? Is there anything on this list that could be the rationale? Maybe they know it's wrong, but they don't really think the campus cares because nobody ever gets kicked out of school for it, and it just happens over and over again. And it's not really, you know what, I'm just here to teach, and it's not really my job to enforce all of that. Or because we've often found that if in that particular case, which is a modified bystander approach, is when we take faculty out of the responsibility to actually adjudicate the academic integrity or incidents of academic dishonesty, sometimes that's enough for some of them to report. When it's not my responsibility, I may bring it forward. So, but not always. Sometimes you see the opposite, so it depends on your culture. But maybe some of these things are existing amongst others. I've had some amazing conversations with campus police officials and campus security professionals who serve maybe not as licensed officers, who have seen things, and even though in their own professional charge have intuitively known it's wrong, but when they don't see the rest of the campus leadership responding to it, they don't intervene. Or they go, well, we thought that was a problem, but apparently it's not. So the application, I think, for this is big. And I cited Berkowitz on the slide, Leslie, but really, isn't this the research they started in '68?
Yeah.
And they've just reaffirmed it since that time? Okay,
Yep.
I want to make sure I got that right.
Yeah. So we can take what we know and how do we hear this in student terms? So what do we hear our students saying? And listening to students, I think, is key, and that's actually how we started on this initiative, because we had a student pass away from a drug overdose, and throughout that whole situation, there was lack of people intervening. And I said, what do you guys need? And they said, we need the skills. We need to know how. So listening to the student voice is a huge component of bystander intervention and creating buy-in to actually get something that can work for your campus. So students might say, well, I assumed it wasn't a problem. I assumed it wasn't an issue. And we can interpret that back to pluralistic ignorance if we're going to connect it back to social psychology. They might say it was none of my business. I didn't know that person. She's not in my sorority. He's not in my student organization. Or it was just none of my business. I didn't want to get involved. She seemed like she was depressed and really unhappy, and I was afraid to say something, or that's just not my responsibility. Sometimes also they're just going to say, well, I assumed somebody else would do something. I assumed that somebody else would intervene, especially when we're talking about the people that we think should intervene, maybe the chair of a department, or maybe a bouncer at a popular bar in town. They might assume that somebody else is going to do something, and looking up to that behavior, and sometimes understanding that not everybody's going to do something is an important component for people to understand. They also believe that others weren't bothered by the situation, so that's actually where sometimes some social norming campaigns or social norming tips can come involved. That's one of the mechanisms for bystander intervention programs, is helping them understand that, yes, other people care. And so how do they know, how can you talk to them about, yes, start conversations, have conversations and dialogue among your friends, among your groups, and start talking about the fact that, people want help, and yes, I'm bothered by the fact that everybody goes out to blackout on a regular basis. And so having this dialogue with students and with staff is actually very critical. They'll also say that they didn't know when or how to intervene. And so there are a number of different ways for people to intervene in situations. They can be direct, like actually stepping in and breaking up a fight. It can be more like indirect, such as calling 911. And so they also didn't know, when should I call? When should I actually say something? When should I have that conversation? And so teaching them that there are a number of different ways to intervene in different situations and helping them walk through that problem-solving process is a key component that can be a part of your program. And then also felt my safety would be at risk. We don't want to put students at risk. And so it's important to understand we're not suggesting that with the bystander intervention program, and that your program's not suggesting that, but they will be weighing the costs and rewards when they're going through the problem-solving process in our heads. So sometimes we might not intervene because we're scared. Certain situations potentially that I might not intervene because I don't feel safe, but I can certainly pick up the phone and call the police department or call 911. And also sometimes what I've learned too is talking to students through the difference between calling 911 and calling our campus police department. I'm not afraid to pick up the phone and make a phone call, but when I suggested that to a student and we were going through scenarios, his eyes got really big at me. And I was like, oh, okay, hold on. Like the campus police are, there to educate. They're just there to check it out. That's why I'm not calling. I'm not calling just to, cause a big ruckus in terms of 911. So understanding and helping students understand that those are two different things, and understanding that maybe campus police has a different approach than just the community police.
Well, and Leslie, what I love about this is I love, one of the things I love about here at Vermont is I've had people share amazing student stories with me. So if you have any, usually they're like surprise stories, like Anne Frankie, who's just a dynamic leader in risk management, stopped me last night because she needed me to know that the Sigma Chi president at the University of Rhode Island at the National ERMIA Risk Management Conference, who sends 4 fraternity presidents into a room full of university risk managers, Tom Dugan, the VP at University of Rhode Island, that they had students in the room and were asking them questions about risk, and that this young man had nailed it. And the people were kind of shocked because they thought students don't get this. So I love to hear those good student stories. This is a good student story to me. Because when you hear a student say, hey, what's my problem? Does that annoy you? How many of us have heard a student say one of these things and assumed they're insensitive, selfish, don't care, self-absorbed, maybe we'll just call them a millennial or Gen X, whatever generation we're in, or hey, that wasn't really into my business. And how many times has there been an intuition inside of us to say, so really you're so all about yourself, or you're not really part of a community? Now, I'm not saying there's not periodically that young man or young woman who isn't saying exactly what you're hearing, literally. But just step back from that for a second. And when we look at all that research about why people, not students, but people don't intervene, look at the student voice. Maybe they're not saying, I don't care. Maybe they're saying, I kind of saw this as a problem, but when nobody else reacted, I thought, okay, obviously my little barometer's off a little bit. Or, I didn't know what I was supposed to do. Well, how could you not know what to do when you see someone lying on the floor, obviously passed out? How could you not know what to do? Literally, we can get very frustrated with that. But maybe there's this principle of, I knew there were 20 things I could do, and I just didn't know which one of them to do. I've really found, particularly with alcohol poisoning, we have decided they already know all the signs and quit talking about it. And you know what they know? That if you're kind of ashen and your lips are blue and your pulse is really shallow, we probably should call 911. I need you to get involved sooner than that. So hear what the students are saying, but don't assume that the glass is empty. Because maybe all they're using is the student voice to say, by the way, we don't intervene for the same reasons socially people don't intervene. That's a really key thing for me in this that I've learned, because I think, Leslie, that we've also found that when we took this to the college campus for research, that students do want to act. They do want to do something. We have learned from student voices that if they understand your prejudices, and prejudices aren't always negative, if they know what's not acceptable in a community, that they are more likely then to speak out against it. Interesting. So it's, I sometimes hear the wink, wink, nudge, nudge commentary from students. Yeah, they told me all the rules, they told me all the policies, but then I watch 80% of the people violate them at a football game. And I think, oh, wink, wink, nudge, nudge. So underage alcohol consumption or something other than beer, open container laws don't apply on game day. I don't know if anybody else works on that campus. I worked on that campus for 15 years. Or maybe it's not as literal as that. Maybe it's something along the lines of young men and women coming in. I worked with a young man who came from a very isolated community, and when he entered into a very diverse student club and organization that was open in their membership to undefined sexual orientation, didn't matter how you defined. Gender, identity, whatever, didn't matter. And he had a difficult time with that. What helped him through it was when his members of his group said, this is who we are, and we're okay with this. They expressed their prejudice against those who weren't okay with it. So then he knew within his club and organization that if someone told a joke, an off-color joke, or used a derogatory term like fag, that he should say something. So it's not like, oh, that's all we have to do, but that's a piece of the knowledge. Students traditionally are pretty bothered when people do bad stuff. We really found this with residence hall students and students in academic settings in the classroom. When the research went out, I didn't do the research, the researchers found it, I found it in the literature. I'm just so excited about it, I think I'm part of the movement, but I'm not really. I'm a poser. Leslie's in the movement. But students are pretty bothered by behaviors, problem behaviors. You've probably met that student. Or when a student's in the classroom and they're kind of watching something that goes on, and they have that, I think that person's cheating. I remember Sunday Salzman. I'm even going to give you her last name. You could find her on Facebook. I remember her pulling her Catholic schoolgirl uniform up with all the answers to the physics exam right there on her. Like, I could have written a lot more answers on my thigh in high school than she could. She was a little skinny girl, and I've never been that tiny. And I remember thinking, what is she doing? Like, man, this guy curves, and she just blew the curve, but not legitimately. Did I say anything to her? No. But now I have just publicly shared her name with all of you, and I'm still a bystander, but I'm a gossip. I don't know. Student leaders, really, this is interesting. Student leaders underestimate what their members, their teammates, or their peers want them to do. So think about that dynamic. Students and people think, it's not my job, somebody else's job. But the people whose job they often think it is don't do anything because they think their constituents don't really want them to. Well, if this was really a big deal, they'd say something. I don't know if that's, we don't have the data specific to having had faculty or staff say that. But I just recently visited a large public university and sat in a division meeting and watched some relatively high-profile bullying behavior go on. And I watched the people that I had been working with for like a week on this campus kind of siege up as this person was directing the meeting in a very bullying fashion. And I had about a 2.5 second of like victimization, and then I thought, oh, I don't work for you. Guess what? I don't have to play. But the reality is that and I spoke up professionally and managed my intervention. I didn't walk out because I had to respond a certain way. But how interesting it was for me to have directors of departments come and say, wow, thank you. And me to say to them, really? Because I was afraid that you were going to tell me to dial it back because none of you did anything. Do you see how that could translate outside of students? And then if I know you're going to do something about it, then I'm probably going to do something about it. So all of these things, knowing this information, can help you think more critically about the development of your program. Make sense? I think that's a really key part of it. And you know, Leslie has worked with the Step It Up program at the University of Arizona. And is this not something that you do like a study of your own campus when it starts? You're going to talk about that later. But.
Yes, I will talk about that when I talk about the program. But essentially, they have a model for creating a survey. And so what they found was that this is what students' responses were in terms of why they will intervene. So I think what this does is it gives us hope that they feel like it's the right thing to do. They believe that friends should look out for each other. And so that they would want someone else to help them in that situation. So I think this gives us hope as to why they will act and to try to understand what are the factors so we can capitalize on those factors.
You actually watched this at the University of Maine. They had a grant, it was actually an alcohol grant, and they decided to use it to develop a bystander intervention initiative. And they queued this up with athletes. And they found out that it was a really compelling information to find out that the bystander effect looked just like the research said it was going to look. They didn't have any outliers. There wasn't some new excuse that wasn't on the list, but there also all the excuses were there. So that was first for them. They're like, okay, we're normal. Our people are not intervening for the same reasons social psychology has said. No outliers. But then when they went into their athletic program and asked these questions, how powerful was it to then put these back in front of other athletes and say, this was the voice of your peers. That doing something when I'm too drunk to stand up at a party is the right thing to do. And you should do it because you're my friend, and I want you to. And you should do it because you would want somebody to catch your back. And that I needed your help, and I was beyond capacity to help myself. And and if you don't intervene, how much worse has it got to get? Is your only intervention going to be 1968, call 911 after? And you know, at the end of the day, we're all on the same team, and our individual behavior reflects that team. Like, can you imagine that message coming from students? And what we know from the research is it's quite possible it could. Now, here's the thing that I don't know, and you may. Have we worked with an institution, Leslie, through your work with this program, where they have found a clear just apathy, no students having a willingness to intervene? When you went to your training at Stepping Up, did they talk about that?
Not that I know of. And I know that when we did our assessment where we asked about likelihood and whether or not they think somebody should do something, the numbers were off the charts in terms of response. Our numbers were lower than the Step Up program's numbers were in terms of understanding the overall. They would have more people feeling like they would want to intervene, but our numbers were in the 85 to 90 percentile in terms of wanting to intervene. So this is definitely something that students want to do, or people I think have the intention to intervene, but all of these societal factors play a role as to why not. And so we have to do something to try and fight those barriers to try and increase
But
them.
pretty consistently,
Yeah.
we hear that when given the chance to talk about it, we should be hearing they want to do something. Why is that important for this session? Because that means an investment in this pretty under-researched outcome, like evidence-based research, might be a good gamble. You know, I'm an advocate of evidence-based research and data-driven decision-making, but I also know when I'm going to bank on a good deal. Anybody here use peer educators on your campus for anything? Dr. Linda Langford taught me that that's the most under-researched best practice in the country. Yep. She said, we just know it works, so we don't spend a lot of time questioning it. There's some research on it, but not the depth that we might see in other venues. And I think the other thing that the research tells us is kind of part of the warning before we transition into the actual steps of building the program. Do you want me to hit these really fast?
Yeah,
for you?
go for it. Yep.
Big thing, pay attention. There's 5 things that are involved in being in bystander intervention. Those of you who've played in this world at all will understand why this is important. First, you got to notice the event. You have to see that something's going on. You have to get outside of your shell. Sometimes that can be a literal conversation that's why we try not to walk with our heads down and our iPods on, not just for safety, but you got to engage in your community. But notice the event. That means we don't get so much tunnel vision that we don't pay attention to it. And after you see it, think of that little Catholic schoolgirl plaid skirt, boom, physics exam. For some of you, that might be too risky, so don't think about that. Then you have to notice that it's a problem. So you may see it, but if you're not bothered by it, why would you care? Think about the extreme cases in the media, woman on the floor in a hospital. How many of you would have gotten up and provided some assistance to the woman when she fell out of the chair? I had someone, I think Aileen is with us, who said, now that I'm 54, I will intervene all the time. But when I was 19, I didn't feel empowered to intervene. I would like to think a lot of us would get up out of our chair in that emergency room and render aid. Yes?
What's your take on this? When we model behavior for our students, I was in the situation where a student was lying on the floor. And on the other side, there was someone being bullied. There were 2 staff members, 2 faculty members, not saying anything helpful. I'm a student government officer, and the school says to me, well, that is your problem. It's my problem that I have to see in my office, but the thing is, we also model behavior where we don't care.
Right.
I had a school situation one time, and the students told me that, why do you care? There was other people who didn't want
Who didn't care. Exactly. And what can happen then is the person acting on the behavior you can have a chance to shift their position, to use the Berkowitz term, when you have your conduct meeting and say, here's why this is a problem. But you're exactly right. We have to role model. That's why I think this is a student initiative oftentimes, but it's very much a campus initiative. Right. But you got to see it as a problem. And the reason these steps are important is because a lot of the early stuff, not early, I mean like most recent stuff that hasn't been fine-tuned, starts with the 3rd step. And that's when somebody comes in and just says to your students, you have a responsibility to act. You took an oath. You went through the ritual. You've blah, blah, blah. You need to do something about it. And if you don't, you should be ashamed. And then students are sitting there going, okay, but you know, I kind of am, I get that, but I really don't, what am I supposed to do? Right. Or what if somebody like hurts me because I do it? Or I get that, but when I'm in a room of a bunch of people and nobody else is, do you see? You can't just start there because you have to educate on the events, why they're problematic, then talk about people's obligations to act as a member of a community. That's your hook right here. We're all part of, if you have a campus, it's a community. Then teaching the skills on how to intervene. And then finally, the fifth step is acting. And a lot of times with the bystander stuff, from a lack of intentional strategic thinking, we jump in on the third step. And we decide we're going to do a big campaign to our campus community that says, you are all responsible to take action. And science tells us that's not effective. So when you developed the program at Indiana University, you went a little farther with it,
Definitely.
right?
Yeah, and thinking too, going back to those 5 steps, if anybody fails to act, if you start with 1 and 2, if they fail at number 3, they're not going to follow through. So understanding that the 5 steps are all very important for intervening. So as you try to approach your approach for developing a program, thinking how you're going to do it, what do you want to do? Want something that's more comprehensive, or do you want to do something that is more targeted for specific behaviors? Because those are 2 different things. So at Indiana University, we had a number of different issues, from mental health issues to alcohol issues to drug issues to hazing issues. And so we didn't want to focus on one specific behavior, but what we heard students saying across all issues is that they needed the skills to intervene and to act. Other campuses might focus specifically on, say, sexual violence because it's a hot issue on their university at a time. So so those are 2 different approaches you can take. So there can be a more comprehensive approach that focuses on increasing intervening behavior, and then a more targeted approach that specifically focuses on decreasing one set of high-risk behaviors. So either are fine. And so how we actually developed our program and how we would recommend and totally using this framework with your own university for program development in general is to first identify key stakeholders. Who do you want on board? Who are the people that you need to involve in your conversations? So if you're going to do something more comprehensive, that might look different than, say, something that's targeted in terms of alcohol and drugs. So at IU, what this looked like was talking to colleagues that I have already relationships with from the residence hall programs, from the athletic department. I was the Greek advisor at the time, so those are some 3 target audiences that we had outreach ability to. And then also working with our counseling psychological services office, our alcohol and drug information center, and getting a team of people that I knew were involved and invested in, and we just started the conversations. The second was to conduct a problem analysis. And so this is to really identify, what does the problem look like? If you're going to do something more comprehensive, then try to understand it in terms of maybe the bystander effect. Why don't people intervene? Asking questions about that issue. If it's more targeted, then looking at, what does some of your campus data say? What does maybe the local data say? And what does the national data say about the situation? So really doing a problem analysis and identifying, what is it that you want to change? Like I said before, do you want to increase overall intervening behavior across the board? Do you want to try to decrease sexual violence? Do you want to try to decrease the high-risk drinking that's going on? And so identifying what is that you are specifically trying to change. That is key. And then using your campus data and national data and the literature that's out there to understand the problem, I think is also important, so you can benchmark, but just to better understand the issue. I'm a research nerd, as Kim would say.
Can I ask you a quick question about that?
Yeah.
When you did your work at IU and you did your problem analysis, so what you decided that needed to change, and this is really like I'm learning, I'm watching her and I'm learning, I'm sorry.
She does this to me all the time.
Is that you needed to decrease the number of bystander incidents.
Right.
And you needed to increase the amount of action.
Yes, so we had a student pass away from a drug overdose. And what we learned from that situation is that there were different times in that situation where people could have intervened and did not. And then we had a couple of other situations that were sexual violence related, mental health. And so what we learned, I said to the students, like, what do you need? Just in one-on-one conversations with some fraternity presidents, and they said, we want a bystander intervention program. Kim had come to our campus one too many times in a good way. And so I said, okay, like, we're gonna find that for you, we're gonna get some funding, and we're gonna do it. So that was basically what the students said to us. The third one, so once we got our team together and we got some funding and support, we did a scan of existing programs. And so that's, I think, incredibly important in terms of, you don't have to read all the literature, but some literature is important. And so trying to figure out what's out there, setting up phone calls. We talked to Jenny, what's her last name?
Jenny Rabis.
Jenny Rabis from Central Missouri. We talked to the Step Up program out of University of Arizona. We looked at Green Dot, almost at somebody to one of those trainings. And then we said, we need something comprehensive. So that fits our needs. But every campus culture is different. Ironically, now we're in a place that we have our comprehensive program. We are going back through the problem analysis stage, and then we'll probably be developing other programs targeting specific behaviors and picking out which one is our next behavior that we really want to identify. So conducting a scan of programs, asking what works at other universities, and then that slides right into the next one of adapting a program to fit the needs of the university. So even if it's evidence-based, if you find a program that says this works, actually applying it and implementing the same fashion is going to be challenging because each campus is environment. One size does not fit all. So trying to find out ways to adapt the curriculum to fit the needs. And what this looks like for us was we did focus groups with our students. We talked about bystander intervention. We did the program. We're actually still in the piloting stage because I like to take a while because I want to make sure the program is really good before we do a full-out blast to students. But for example, I just did one with our student organization ethics board. I ran through most of the presentation, and at the end we just sat and we talked about it. So what do you think? Also, I listened when we do the videos and when they would laugh, when they didn't laugh. So I tried to engage, figure out when students were engaged in the program and when not. Also with the Step Up program, we did a survey, and so we used our own social norming statistics for that. So adapting the program to meet your needs. This can look like a variety of things. The fifth step is implementing the program. Hopefully you've already thought about this in advance, and maybe that's why you asked certain key stakeholders to be on your committee, but trying to figure out how are you going to implement the program, what mechanisms are already in place. Do you already have some peer educators that maybe you can utilize? What this looks like for us is that we're going to start recruiting some interested staff members and do a pretty intensive, I think, training for the program, and then we're also going to have peer facilitators take a leadership course that we're going to teach and have curriculum for because we want to make sure that they're trained to talk through situations and scenarios. And so we're going to roll that out, and then eventually our goal is to have this be part of our Greek curriculum, residence hall curriculum, and really implement it across the board among our students. The last step is critical to evaluating the program and then making changes. So making sure that you have surveys or focus groups that go out, and then continuing to catch yourself up to speed in terms of the literature for the programs and adapt it. It's an iterative process, and that's important for program development and implementation to make sure that you're listening to the students, you're changing it to fit their needs. They might not say that they enjoyed a program necessarily, so assessing the learning outcomes, how they're intervening. One way that we think about that we might evaluate our program, this was a student's idea, is one of the teaching tools in the Step Up program, we use Poll Everywhere. Do you guys know what that is? It's like a text voting service or thing. So you can actually have them text in answers, which is really cool because then you ask them questions and it's anonymous. So if you're asking about high-risk behaviors that they might be, that are a little bit more sensitive and they don't want everybody else to know their business or what they think about something, you can actually text it and use it as a teaching tool. So it's a great tool. But we might actually create bracelets and give them a number and say text KRIU, and then we can have them send us open-ended responses as to how they've intervened. And then we can actually download the data. And so, because I'm trying to find ways to prove to our dean that this is working. And I know that he wants to see that, our provost wants to see that, she's on board with our initiative. So trying to come up, especially with students, of creative ways. And I think that's a really good opportunity too. They talked about starting a blog then based on what people are saying. And so trying to get it out there where students are sharing with students, intervening, I think that's key and that's huge, is that they want, the student leaders that we have want to say, as the big brother or big sister, we want you to create a safer environment, so we want to be sharing this message with you, not always coming from staff and faculty.
Yeah. So it's not doesn't look a lot different, right, Leslie, from any other implementation.
Nope.
But I think the reality is like your students came, they said, hey, what should we talk about, high-risk behavior? They let me visit once a year, and as long as your students are risky, I'll keep visiting and collecting IU swag. Kind of a fan of Bloomington at this juncture. And they picked bystander. You know why? Because they heard about it somewhere. Because it was a sexy topic. It had been blown up at their national conferences or regional meetings. And they said, maybe. And so when we talked about it, the power of it came from the students because they said, this might work because we've now seen what happens when we do stand by.
Right.
So this isn't as complex as anything we might have seen, but think about how many times when there's an initiative like this, do we not do these steps? We just adapt a program. Because Stepping Up or the Green Dot program, the great work at the University of New Hampshire, and again, the supplement that's online under our heading for this session is a comprehensive overview of those types of programs for you, are all great programs, and people are sharing their content freely, but the best of them will say to you, don't just adapt it, but you really need to take time with it. And I think there's some key stuff that once you open this box, you need to be ready. And opening the box for a incident. Attorneys in the room? Well, we could have done lawyer jokes.
Oh,
one, no, well,
got
maybe.
one, too.
Usually my attorney friends have the better attorney jokes, so maybe you would have shared one with us. But, you know, I worked with campus attorneys on this. I actually floated this by a couple lawyers. I have 3 attorneys I queue up when I have a legal question. One who his colleagues say over lawyers. Don't know what that means. Yes, you do. You might actually work with that attorney who is like really conservative over lawyering. One who's very student affairs friendly and savvy and good attorney, but also lets student affairs people do their work. And then faculty do their work and teach and research and do what they do and then gives guidance. And the one who's kind of in the middle, that kind of depends. Some days he's a little afraid of us getting sued, and other days he's more like, do your job. And I always run stuff by all 3 of them when I have a big issue, because then I feel like I can hit my clients pretty well, because I can say, well, if you ever really, I got a great conservative attorney's opinion on this. And I ran it by them, and they said that this first key thing to consider might tweak some people out. Because if people start to act, open that box, and people start intervening, what that could look like is instead of our colleague, the conduct officer, having to be the one modeling intervention, he may start to get more reports. Because that's a method of intervention, is just reporting a behavior. You don't always have to throw yourself on the gauntlet. So you may start to see more claims of incidents. And that could cue somebody up to say, well, is the problem getting worse? So my ultra-conservative lawyer said, so have something prepared along the side that says, you're asking, why are you reporting this? I intervened. Where you can show a parallel so it doesn't look like our campus is just going crazy with a high-risk alcohol behavior or incidents of racism or homophobia, that it's actually people responding. So that was one piece of advice. So I think you need to be ready, because once you really get to that skill development and you give that empowerment, you will start to see people more inclined to act. Yeah. So you need to be ready for that.
And I think thinking about that in terms of sexual violence and sexual assaults, and with the OCR Dear Colleague letter, is that we might just start seeing more sexual assaults that are reported. But what we know, I know the number that Vice President Biden uses is that 1 in 5 college women will be sexually assaulted during their collegiate experience. So knowing that statistic is helpful, because then we can still say, well, this is what is actually probably happening. We're just increase our reporting, and maybe that's a good thing, because then we're getting people more services and support. So the second one, providing appropriate resources to faculty and staff, is key. So as we have more people that are going to be acting, they might go and just talk to a staff member, maybe their student organization advisor, maybe their AI for one of their courses. So we need those people to be prepared to start figuring out, you know, what do they do with that information once they have it. So that goes back to sexual violence or education about sexual assault reporting, but then also maybe mental health issues. They need to make sure that they're connected with, they know about CAPS or counseling centers being a resource, or who they can contact. And so really bridging the gap. I think faculty are a really important group to reach out to. I know that that's important to navigate within the culture of each institution, but it's very important to provide them with resources so that they're prepared and they can be aware of this. So they should also know that this program is going on the campus, and then hopefully you can get their buy-in and their support of it as well.
Yeah, and I think that providing resources is also, that's part of that skill training for the intervener, knowing who to call, when to call, how to call. And you know, don't oversimplify the curriculum. This is not as simple as just a social norming campaign. That's part of it. Social norming being telling your campus what literally the truth is, but understanding that this is an area that you need to be cautious, because some college community social norms they would not want to use in an educational campaign, because they're actually not the norms they wish they had, and what needs to change is their norms. Does that make sense? Not everybody has beautiful social norms. Not every one student drinks 3 or fewer drinks once a week out in the community. Sometimes you'll do your assessment and find out, which I think we've experienced at Indiana University, We're not going to really throw those numbers out there because they're a little high right now.
Yes, they are.
So don't oversimplify it in thinking it's just as simple as a social norming campaign. But also don't oversimplify it by really the way I see this happen most often is jump into that third step, that you must be responsible to act. That is not enough because science has told us there are barriers to that. So issuing the challenge without the skills that go along with it can be a really oversimplifying, something that on one level to me seems like, wow, why have we not been doing this more? And why did it get so hot recently in perspective of higher education? And then the other side of it is because it's not as easy, maybe as simple as it looks. So I think that's key.
And I think with that, if you just do a campaign and you don't provide them with the skills, they're not going to feel very empowered if they feel like they don't have the skills to do it. And so conceptualizing how that might actually be a disadvantage to the program and understanding that. So you probably need to have both in some capacity. What we know from research is that knowledge alone does not change behavior. A 45-minute presentation on one topic isn't going to change behavior necessarily. So figuring out what programs are aimed at actually changing the behavior and using a lot of public health theory can be a part of that. Or anyway, just understanding how to actually provide people with the skills, provide them with awareness. Just having a 30-minute presentation isn't going to do it.
Just saying this is a bystander and
We
this
know
is a
that.
problem doesn't change behavior.
Yeah.
You know, take that one with you on everything you do. Knowledge alone, Linda Langford taught me that,
Yeah.
CADNEB. Be aware of the outcroppings of other campuses' initiatives. Because this is hot and it's buzzing right now, other people will start to develop initiatives. And so if you're really working on a comprehensive or even a targeted initiative specific to, in Central Missouri is the one that I always think of with the alcohol, high-risk alcohol consumption. I'm working with a couple campuses right now that are using this as their hazing prevention initiative specific to hazing behaviors. But there's knowing that other people on campus might be sitting in rooms and hearing about this, so they want to also create a program. And we have all lived in that world at some juncture where we're duplicating each other's work, and the other folks maybe aren't doing it at the same high-profile level that you are, on the message that's not managed. But be aware that this becomes very attractive to a lot of players. And if you are working in an environment where collegiality and collaboration are not the norm, you may end up with a residential life bystander education program, a fraternity and sorority life bystander education program, and then something that comes from the AOD or the Health Wellness Promotion People Prevention Program, which isn't necessarily bad unless they're not all designed for your campus with some common themes. So just be aware because it's popping up. You've already had that in like 4 or 5 different places,
Yes,
right?
yeah, we struggle with that. And so our overarching umbrella is culture of care. And so my boss will even say to me, stop calling it Step Up IU. I want you to call it the Culture of Care program. So, because I feel like it's really important for students not to get confused. So figuring out what that message looks like and bringing them on board so that your initiatives can be aligned and developing partnerships is key. The last bullet point is that multiple strategies work best. So a 2-hour bystander intervention program isn't going to solve your problem. I think a lot of literature shows that programs such as like Alcohol EDU and the Green Dot, they might show some effects immediately following, but if you don't do any type of additional sessions or additional messaging, that they're going to lose the effects likely after 2 or 3 months. So I'm making a generalized statement, but that's basically my understanding of intervention programs and what the research is saying. So making sure that you remind them of the 5 steps. For example, we are putting the 5 steps on some water bottles to give to people after their presentations and trying to find ways to pass out cards and information so that they see those 5 steps, they remember the 5 steps, because I think that also our evaluations are showing that that's what they liked the most about the presentation.
Well, and we've seen really great stuff with that. I really like the wristband idea. Twitter feeds, there's a lot of cool stuff with that right now, going on national campaigns. We did one with hazingprevention.org called the 40 Answers, where we picked the top 40 reasons students give us for continuing to haze, tweet them out, and then people just organically respond to them. So Twitter campaigns or multiple entry points, I think, is a strategies. And again, don't just go, oh, a Twitter campaign. Make sure your campus tweets, because not everybody tweets. Some campus communities, and I get that when I visit, like you can tell when you're on a Twitter campus because they're like blowing you up on the Twitter feed right away. And then, you know, sometimes you're like, hey, do you have a hashtag? They're like, hash, the speaker wants hash. What is that? That's awkward. What did you get for bringing an older lady in? What's up with that? So I think there's some really innovative and creative stuff out there. Ultimately, what we know is that the truth be told, and not just from the Kim and Leslie perspective, but from Dorothy Edwards, who initiated the Green Dot program at the University of Kentucky with amazing peer education models, and was so successful on her grant there that she took it independent and is now working with lots of other campuses. So, or Mary up at the University of New Hampshire, who is truthfully a faculty member and a researcher, and loves to feed us the faculty research, but then says, you go out and do the touchy-feely presentation stuff. You know, for all those people, to Jenny Rabis, who said, I think the answer to high-risk alcohol consumption at Central Missouri is that students have to intervene. Rules are not working, policies are not working, police enforcement's not making an impact. And here's the exciting thing. With clear support from the grant underwriting agency, 94% decrease in incidents of injury or harm caused by high-risk drinking. Jenny's not going to tell you that 94% decrease in drinking, but high-risk alcohol consumption measured outcome. How amazing is that stuff, right? So we know that think about that. Intuitively, we don't know from all the research. Jenny's research is about the most substantive. You're the one who taught me this, that this is one of those things that's kind of hard to study.
Yeah.
Like, why did people intervene, or what caused it in this particular situation? How do we know that bystander intervention initiatives are what changed our campus community? Intuitively, I just think empowered people do the right thing. And that when we know why people don't do something, truthfully, what we know is maybe what needs to change and how to get them to do something. It's really painting that picture of the design, what it should look like, based on we know what it shouldn't look like. And you know, this guy, 25 years working on it, is the one who said he's seen amazing change. The military has recently contacted with Dr. Berkowitz in their sexual assault, sexual violence. He's doing their education and curriculum. So, I mean, there's some big players in this, and it's effective, but it will be more effective if you think intentionally, truthfully intentionally about the design. So we have nailed our time, and will not have a flying shoe coming to the stage,
Good.
Which I have to tell you, Les, never happens to me.
I know.
So I'm kind of excited. We kind of want to do a happy dance right now. Could somebody call you again? Because that was like a good song for us. You know, I liked it. It was good. It kind of perked me up there partway
I know,
through.
you started dancing.
So what do you think? Questions, concerns, anything you want to fill our time with? Yeah.
What are some of the ways that you train your students to intervene, besides the obvious, the student falls on the grass? So I have a question. We are
Brainstorming new and different ways. One of our staff members, we connected with our police department, campus police department, and we did an example of a 911 phone call. Because I had a situation where one of my friends and I, we saw something kind of ambiguous, and so we talked about how do we intervene or not. And I was like, why don't we just call the police? And she's 3 years older than me, and she said, well, I don't know. After I got the phone, she was like, I didn't know what to say. I was like, well, if she's 33 or 34 years old and doesn't know what to say, then our students sure don't know what to say. So we did some examples. We did 2 different examples that we're going to use in the scenario portion. And so really we give them different scenarios on mental health, problematic eating, discrimination, alcohol, like along the spectrum, and they talk about it. So during our workshop, our presentation, and this is just ours, we talk constantly, constant dialogue about scenarios and intervening and different ways that they could intervene.
Well, and it's interesting because it's a model, and Darcy, if you drop me a note, I'll get it to you, because it's a screenshot that Alan Berkowitz designed that's almost a mathematical equation, because you can be direct in your intervention. That would be when the person on the plane 3 weeks ago that was 6 rows behind me was being so inappropriate with homophobic, derogatory commentary that I just simply got up and went back and said, I'm not sure if you know how loud you're speaking, number one. Number two, if you are aware, I need to share with you that what you're saying is it's really offensive. And I only do that because I think Alan says, do that. Sometimes I don't always intervene, and we all don't always intervene. But there's that's very direct. An indirect mechanism for that is to say to the flight attendant, is there anything we can do about the guy? Because you know what? If bystanders happen and she's hearing it too, and it's somebody else is hearing it and somebody else is hearing it. So I think that's a key thing, Darcy, is to know that that's another big error where we forget to tell people that you don't have to stand up in a student organization meeting and say, stop, we can't do this, and be embarrassed or retaliated against. That there are, and this is sometimes hard for students when you get them engaged. I just worked with 185 RAs at a college in the South just this past week, and we did a conversation. And I said, what if you walk into an environment in a residence hall room, and people are drinking, and you know they're not supposed to be, and you know it's wrong, and you really don't want the consequence of it, you know, and they said, well, but people will sometimes just sit down. They don't want to conflict with their roommate, so they're not going to say, this is my room too, take the beer out of here. I'm like, so what's wrong with saying, turn around and walk out? Well, but they may not walk out because then they're socially judged as, oh, Mandy P&B doesn't like alcohol in the room. I said, what's wrong with saying, you know what, I got to grab something down at the desk? And leaving the room and going down to the desk so that if you need that purity of soul and heart, picking up a piece of paper and grabbing it and saying, okay, I followed through. What's wrong with it? Because do you know what we know is that when you go back to that definition of bystander, your presence and your decision not to act can reinforce the behavior. So it can be doing something, can be removing yourself. Now, what I hear from RAs when I train that is, well, that doesn't change anybody's behavior, and they should have stayed, and they should have done something. You know what? It sent a message indirectly that I'm not accepting this, I'm not standing there and acquiescing, and then maybe later on I'll have a more direct conversation about, can I talk to you about the alcohol use in our room? You know, that's a key. And so Alan has this direct, indirect, and then under each of them there's like 4 or 5 other layers of strategy. And then you just do all this math, and there's 1,000 ways to intervene.
Yeah.
So I think the training on multiple ways, and I love when students come up with creative and innovative. You throw a scenario at them and say, what if you saw this? What would you do?
Yeah.
They'll be authentic in a student voice with what they might actually say. And it may shock you, but if it were to stop someone's behavior, isn't that ultimately
Yeah, and they can come up with a variety. Along with the direct and indirect, there's also emergency and the non-emergency.
Yeah.
So like I said, calling 911 versus just calling the police department and just giving a heads up.
Or not calling anybody.
Right.
Just stepping in.
Yes, exactly.
Yeah.
So helping them conceptualize those things.
Great question. Other questions or anything? We so appreciate you joining us. Make sure you fill out your evaluations. Come back and see us again.